Yeah, you remind me of butterfly dolls. Waist tight with a body like dog.
Good morning, YouTube. Today I thought that I would talk about clinical behavior analysis and go into explaining what it looks like when somebody walks through my door, explaining kind of the whole process from the functional behavior assessment to the plan to discharge, and kind of what day-to-day stuff looks like as a clinical behavior analyst. So my name is Aly. I'm a clinical behavior analyst in the Boston area, and I have been working in clinical behavior analysis pretty much since I got my license. I was trained in more of the autism field. I actually have my master's degree specifically in autism. But when I graduated and got my first role, it was actually treating disorders such as, anxiety, depression, bipolar disorder. I was seeing a lot of reactive attachment disorder. So as I was getting these referrals and working on a team, I really had to completely change the way that I was practicing behavior analysis, and also vastly expand my knowledge and collaborate with others to really be able to practice in an ethical way and get to a place where I can treat these disorders, in my office independently. So let's start with what it looks like when somebody just walks through the door. So typically when somebody walks through the door of a clinical behavior analyst, it's because they're looking to work on a behavior that is typically probably treated in more of a talk therapy kind of setting, which is why my office has this kind of look. So they're usually walking in and looking for help with symptoms around depression, anxiety, PTSD, like I was saying, all of these different disorders, right? People are complex. The disorders that can walk in the door can really range. But I would say that's what I'm typically treating. And usually the symptomology that we're looking at is also pretty common for those disorders, right? So school refusal, having trouble getting to work, having trouble in interpersonal relationships, sleep, so many different aspects of a life. Dating is a huge one. So a lot of different aspects of someone's life that they're having trouble with and that they would like some clinical support around. So typically someone is coming into my office because of a disorder that they're having trouble managing the symptoms of, or they're coming in to work on a very specific behavior that they want help kind of shaping over time or coaching around. Think about, we have New Year's coming up, so there will probably be some people looking for kind of New Year's resolution help, maybe help around exercise or starting a new hobby, something like that. So when someone walks through my door and sits down, the first thing that I'm going to do is kind of just start making small talk and figure out what brought them here and how they came to find me and what they generally know about what the process is going to look like. So I'll start explaining to them the same thing I'm going to explain here now. We start with a functional behavior assessment. So when I am starting with somebody, I'm going to have to ask them a disgusting amount of questions. I'm going to ask about your whole life, every single piece of it. I'm going to ask about your day-to-day, your schedule. I'm going to ask about your eating habits, your sleeping habits, your bowel movements. I'm going to ask about your medical history, everything that is really important for a behavioral profile, I'm going to be asking about. In addition to that, it's going to depend on the client. So when I have somebody that's coming in that has had maybe complex PTSD, or they're having trouble with a specific traumatic experience, I'm probably going to utilize some other tools to help them. So I'm going to be looking at some tools that are looking at more aversive stimuli so that I could help coach that individual around how to learn their triggers in the environment and manage that. If I have somebody who has some depression symptoms, I'm probably going to use a tool more geared towards depression, right? So it really depends from there, after gaining all of that insight about, medical history, psychological history, academics, the ins and outs of your life, about, as I was saying, your water intake, your bowel movements, what you're eating, what you spend your day doing, everything. So I'm going to ask all of those questions along with the most important question. Give me 3 things that brought you into my office that we need to work on. So with that, from those 3 things, I usually end up developing what I think should be our target behaviors. And what I think should be our target behaviors may not end up being our target behaviors, right? Because I'm the behavior analyst, I'm not the client. It's not my life that is going to change. It's not me doing the really hard work, it is them. So if I am looking at these 3 goals that they've set out, I'm going to tell them, okay, I think that we should work on this behavior, and this behavior, right? Because I think that these are going to line up with your goals based on everything else I'm looking at. My client might come back to me and say, yeah, no, I disagree. I don't really want to work on that. And that's okay. It might not be the time for them. They might just totally disagree with where I'm coming from, or it might not be the right approach for them. Totally fine. They are in charge of their therapeutic process. So we're going to start there, and from there we're going to keep defining it until we can kind of agree upon a plan and where we're going. So once I kind of do that functional behavior assessment, I am going to also go over the functions with my client. I'm going to say, I'm often having them take their own ABC data, or when they're coming to my office and talking about an event, kind of similar like you would in a talk therapy setting, right? You're saying, I got into a huge fight with my mom this morning, and they're just kind of venting, or it comes off that way, but I'm taking ABC data on what they're talking to me about and interjecting with some questions about the environment and what I think is going to be helpful to help me really have a good picture of what happened. So once I have either ABC data, or sometimes I'm also doing observations, I sit in on a lot of family therapy sessions, which is really fun. I get to be the creepy one in the back, sitting on my laptop, just observing everybody and chiming in with good ideas. So I've been told. This is a parent that gave that description to me, and I thought it was honestly exactly what it feels like. It feels like I'm a creepy person in the back just chiming in with ideas sometimes. So sometimes that's what ABC data looks like, and manipulating variables. So once all of that portion is done, I'm sitting with my client and saying, hey, here's the functions of your behavior. This is what I think, may be causing your symptoms or your symptomology. And from there, I present the plan, right? So I'm often, prescribing things that look like environmental changes, about, using supports that are helpful for executive functioning. For depression, I'm gonna maybe recommend that you make things a little bit more accessible to you, that are going to help you with the symptoms that you're trying to work on. So if you're having trouble getting out of the house, I'm going to say, hey, all right, before you, what is the barrier? What are your biggest barriers to getting out of the house? And if you're telling me, my biggest barrier is that, I already don't want to leave, and then on top of that, I hate getting ready, and it's stressful for me to get out the door in the morning. I always forget my keys. And you're giving me this laundry list. I'm going to say, okay, so maybe what we do is we write down a to-do list of all the things you need to do to get out the door, right? Maybe you get your lunch ready before. Maybe you put your keys in the same spot that your wallet is in to make that easier for you. So helping somebody just walk through their life and make small environmental changes that are going to increase or decrease the behaviors that they're looking to target. So that's kind of what the job ends up looking like. My day-to-day can really vary, which is my favorite part about behavior analysis. Sometimes it looks like this. It looks like sitting in my office and having clients come in. Sometimes it looks like having groups. But it can also look like going into a family's home and getting to sit in family therapy and sitting around the dinner table with them as they talk about topics affecting their family, and collaborating with the social worker or the licensed mental health counselor after. It can also look like going to visit patients or clients in a hospital setting. I have a lot of clients that are being referred because they're cycling in and out of hospitalizations. So being able to start them in that setting and help slowly transition them home is really helpful. Sometimes I am just going and playing soccer outside with a kid. I have 2 kids that I see on Fridays that I leave to the end of the day on Friday. And for me, it's kind of like the end of my week that just completely perks me up and makes me excited that I get to do a little bit of therapy and then go play basketball and soccer for a couple hours. So that is my favorite part about clinical behavior analysis, or behavior analysis really in general. It can look like so many different things and it's so exciting. So that is a really quick overview of clinical behavior analysis. On this channel, I plan on going into a whole bunch of different topics about really, getting more specific about depression treatment, trauma treatment, and I absolutely want to get into how we can better support autistic individuals as behavior analysts, and definitely the comorbidities that autistic individuals experience, because we have a large portion of behavior analysts treating autism, and I don't think many know how to really support other mental health needs of that individual, how to support the common depression they experience, the anxiety, the gender dysphoria, or trying to navigate being on the LGBTQIA spectrum. There's a lot of things that I think that ABA can learn from other disciplines, and I'm excited to dive more into clinical behavior analysis and where we can help move the field in a really good direction to improve the lives of individuals struggling with a vast amount of symptomologies and diagnoses and problems. Because I think that at the end of the day, somebody might be walking into my office because they have a diagnosis, but we're all human, we all have behaviors, and all of them come from somewhere. They all come from our learning history. They all come from our, genetics and our learning history coming together. So I am excited to hopefully inspire some other people to get into clinical behavior analysis and hopefully walk people through how you can get there if you're interested. So if this video is interesting to you, please like and subscribe down below. I would greatly appreciate it, and I'm really excited to keep kind of building a community here together. So that is all for today, and let me know if you guys have any other questions about clinical behavior analysis that you think would be helpful for me to answer. Okay, I'll see you next time.
Yeah, you remind me of butterfly dolls. Waist tight with a body like dog.